After 2 years, the Government of India revoked provisions of the Disaster Management Act for COVID containment measures as per the order issued by the Ministry of Home Affairs on Wednesday. The order copy signed by Home Secretary Ajay Bhalla reads that after taking into consideration that the overall improvement in the situation and preparedness of the government to deal with the pandemic, National Disaster Management Authority has taken a decision that there not be any further need to invoke the provisions of the NDMA Act for COVID containment measures. Accordingly, after the expiry of the existing Ministry of Home Affairs orders dated February 25, 2022, no further order may be issued by the MHA. However, Ministry of Health and Family Welfare advisories on COVID containment measures, including the use of face masks and hand hygiene, will continue to guide the overall national response to the pandemic. I would like to mention that in view of the nature of the disease, we will still need to remain watchful of the situation. Wherever any surge in the number of cases is observed, the states or union territories may consider taking prompt and proactive action at the local level as advised by MOHFW from time to time, the Home Secretary said in the order. He also advised states and union territories to discontinue the issue of orders and guidelines under the NDMA Act. I would therefore advise all the states and union territories to consider appropriately discontinuing issue of orders and guidelines under the NDMA Act 2005 for COVID containment measures. The states or union territories may continue to follow the SOPs or advisories that have been or are being issued by the MOHFW from time to time for COVID containment measures, vaccination and other related aspects, including observing COVID appropriate behavior, he said in the order. Since March 24, 2020, on the direction of the National Disaster Management Authority, the Ministry of Home Affairs has been issuing orders and guidelines under the Disaster Management Act 2005 for the containment of COVID-19 in the country. The central government, in close coordination with the state governments and union territory administrations, has taken various proactive measures to deal with the unprecedented global crisis of the COVID-19 pandemic. The MHA order further reads that over the last 24 months, significant capacities have been developed for various aspects of management of the pandemic, such as diagnostics, surveillance, contact tracing, treatment and vaccination, hospital infrastructure, and the general public has a much higher level of awareness on the COVID-19 appropriate behavior. States and union territories have also developed their own capacities and systems and implemented their detailed state or union territory specific plans for managing the pandemic. Over the last 7 weeks or so, there has been a steep decline in the number of cases, it said. The total caseload in the country stands at 23,913 only, and the daily positivity rate has declined to 0.28%. It is also worth mentioning that with the combined efforts, a total of 181.56 crore vaccine doses have been administered. News Desk, Kaumudy Global.